pleased to welcome Christian Westerhoff, who is Head of Business Development Growth Initiative Health at Swisscom. Christoph, please tell us more why it's so difficult to implement digital health in hospitals. Christian, the floor is yours.
Hospitals are nowhere. Thank you very much. So, I have to say I feel little bit lonely because I was the only one who raised his arm based on the question who is working in a hospital or who has been working in a hospital. And I think that's a pity that so few people are from hospital here tonight, because we had a number of very interesting talks. And on the other hand, we see the hospital side, and hopefully you are not losing your trust in our hospitals here in Switzerland. My talk is based on more or less a number of interviews in hospitals of Switzerland in the past 6 months, and it's looking on the development in those hospitals with regards to digitalization. And if we come to digitalization, I think we have to differentiate the term a little bit, because many hospitals are looking on digitization, so coming from analog data or paper-based data to digital data. But digitalization does mean that we are looking how digital means improve our business processes for the future, becoming more efficient. And in many hospitals, we are still sitting with a situation where we just have digitization. And this is quite often seen as a burden for the healthcare workers in hospitals, that they have the feeling that the add of digital tools to their work is adding additional work to themselves. And based on those interviews of 30 hospital managers, CIOs, or people being responsible for the ICT in hospitals, I did identify a number of challenges. And the very first challenge is that we are lacking the ICT strategy in hospitals. So what does it mean, lacking ICT strategy? Many hospitals already introduced a strategy or started to discuss a strategy, but the challenges from outside are already on the table. So we have the strong need for structured data. We have a strong need for the exchange of data between hospitals and other healthcare providers. Or all these startups we saw tonight, all these startups do need to interact with the hospital to improve the healthcare or to improve the care of the patients treated by the hospital. And the IT strategy of hospitals of the past was very much based on the loudest user. The loudest user got the functionality, but the lacking IT strategy at least came to a situation where the loudest user had this functionality, but the hospital was not developing further in this regard. The next issue is the complexity in hospitals. We know hospitals are very complex systems. They are dealing with patients. Patients are deteriorating, presenting with different symptoms, and you have immediately to react on those situations. On the other hand, the ICT of hospitals is much more complex than the hospital itself. The reasons are on the table. Hospital systems are very heterogeneous. They have historically grown over time. It started usually with a billing application. So the billing department was the loudest user getting ICT into the hospital. And then additional patient documentation came on top of this. But this is far away from an ICT strategy in hospitals. And I think that we have to improve the situation there. We have specific needs of certain specialties. You can imagine that general internal medicine does need a lot of structured data fields to identify the disease of the patient. But on the other hand, we have the orthopedic surgeon who just has the maintenance task for the patient. So working on one of the joints, working on the spine. Okay, we saw spine surgery is quite complex. But on the other hand, it's just a maintenance task. And you don't need that many data fields as you need them in general internal medicine. And then we have many specific interfaces. We are lacking an interface standard. There's a development called FHIR, which is guiding hospitals into the right direction, but we are still on a level where we have very specific individual interfaces between the different applications in a hospital. The complexity, just to give you a relation, is more or less determined by the fact that in a hospital, we have sometimes more than 600 different applications. And you see that these 600 different applications, not used by each and everyone, but by very specific areas of the hospital, have to interact to communicate, to make sure that all patient data is at least stored in one single place, and that's lacking today. We have competing needs. Hospitals need a very high availability of the systems. What does 99.9% availability mean? This does mean 8 hours out of service per year. 8 hours out of service per year is not affecting a single user, it's affecting the workforce on shift. So we are talking about 50+ people in a hospital not able to retrieve data from those systems. And this is usually related to overtime for those people. We have a limited preparedness to invest in ICT. If you compare it to the banking industry is today spending 8 to 10% of their revenue for ICT. A hospital is sitting with 3% or less. Some hospitals in Switzerland are already on 5%, but these are very advanced ones. And the majority, especially of the mid-sized hospitals in Switzerland, is just spending those 3%. And the banking industry has been there 15 years ago. So we do need 15 additional years to come to that level. Although the requirements from the ICT perspective are very high today, as we saw. We have reservations against modern technologies in hospitals. So even the CEO is quite often stating, ICT is a burden for me, a cost burden, and on the other hand, ICT is not adding any value to the business. Keeping in mind that we talked about digitalization at the beginning, ICT will be the enabler of the future to unlock efficiencies in hospitals. On the other hand, we have healthcare workers in hospitals who are still against the digital technology in their work environment. What's the problem there? They usually have the step from paper to digitization, but not to digitalization. So no one is helping them to improve the data entries. And therefore, they are quite reluctant to adopt new technologies. Staying with the workforce, you all know that COVID-19 caused an exit of workforce of healthcare workers in Switzerland into other professions. So we are still lacking the workforce we need to treat patients in hospitals. Therefore, harmonized systems would be strongly needed, because if today the onboarding of a new employee in a hospital takes more or less 2 or 3 days to make him comfortable with all the necessary digital tools, we need systems which are so standardized from hospital to hospital that the data entry is so easy to use or so easy to manage that we may end up with an introduction into an iPhone or a mobile phone. We have to cover all age groups. You know, parts of the workforce in hospitals are 50 plus, and these are definitely not the digital natives we are talking today. Last but not least, information security. We had information security in the very beginning, and many hospital managers think, please let this cup go past me for this year, because they don't have the investment capacity to improve their data security. They don't have the investment capacity to organize, for example, resilience and make sure that they're very quickly up to speed after a cyber attack. And I think we have many, many attacks to hospitals today. We have seen attacks to hospitals in Switzerland in the last 2 years, being not able to do any billing, any documentation over 1 month. And I think this is quite dramatic, and therefore we have to improve the information security, the data security, the cyber security of hospitals. Coming to a conclusion, after these 30 interviews in hospitals with a size of 100 to up to 1,000 beds, I have to say we need standardization. If we are not able to standardize, or we will not be able to standardize, or we will not be able to standardize on our workforce if we align systems, harmonize systems in the very near future. As long as we have 10 different hospital information systems in Switzerland, as we have more than 60 different outpatient information systems in Switzerland, I think as long as we have this situation, we have too much money in the system. We need to standardize between those systems. We need to align the interfaces. We need to define the data sets of the future, which have to be exchanged to improve the care of our patients over the whole continuum of care. This is a quote from a hospital manager I came across during my interviews, and I think he's on the right page. He already recognized what is the problem in healthcare today. And the issue and the challenge today is that not many hospital managers think in the same way. What can Swisscom do? That's the question to me. Working for Swisscom now for 6 months, having done all these interviews, I think we can't come with a new system. We can't come with an exceptional application, improving all the issues I mentioned here. I think what we can do is we will be able to provide a software as a service from maybe a data center or a cloud, and we can make sure that security is around and we have a reliable situation for especially mid-sized hospitals in Switzerland. We're not able to afford these digital steps in the very near future. Hopefully, you keep your trust in hospitals, because the treatment of patients is always the first priority. But digital tools will be able to improve the care of our patients. Thank you very much.
Thank you very much, Christian.